vowing he's going to defend the health care law, Congressman Peter Welch of Vermont. So, Congressman, what goes through your mind when you hear your colleagues speaking about the health care law in that way?
Well, obviously, I disagree with Dan and the Republicans. You know, what happened is the Republicans campaigned effectively, and they beat us good. They ran against Obamacare, as they called it. They want to repeal it, and now they're doing it. They should own it, because the specifics really make a difference to American families. They're throwing out health insurance reforms that are broadly popular in their district and in mine. Things like allowing you to get coverage if you have a pre-existing condition like cancer, letting our kids, when they get an entry-level job getting out of high school, stay on our policies so they have health care, letting our folks, our parents who are on Medicare, be able to get free preventive care that is so critical to bending the cost curve. The Republicans are doing that. They're proud of it. They should say it. They should admit it. They also, in this bill, are going to raise the debt by $230 billion. And they're waving away the reality that the CBO says that's what it will do by saying they just disagree. Well, you got to have an independent referee. So this is a very, very significant decision that's going to have real impact on real families in every district in the country.
Do you feel that you adequately know all the different provisions in the health care law? We've heard a lot of references today, again, about just how big the bill is. Do you feel that you're familiar enough to support the entire bill at this time?
No, you know, I've been very clear with my Republican colleagues that this bill could be improved. And if they were here saying, hey, look, there are a lot of things that we've got to get better, we've got to improve them, we've got to bring down the cost of health care, where, in fact, I think we do have much more work to be done. I'm all in, because improving it is one thing, but literally this wholesale repeal, when you're taking away from people things that they really need, keeping their kids on their own policy, access to preventive care, basically turning the keys back to the worst practices of the insurance company. We don't need to do that in order for the Republicans to make the point they want to make.
So you're proposing, if I could just jump in here, you're proposing to provide an up and down vote on some of the key provisions in the law, a few of them that you've already mentioned, and you feel that that way it would be a good way, it seems almost to edit. You can go piece by piece through the law. Talk to us a little bit about that, your idea, and the reaction so far from both sides of the aisle to that.
Well, the Republicans said they're going to have open rules which would give us those up and down votes, but they're not going to do it on health care, and that's unfortunate, because I actually do think editing it is what the American people want. You know, if you ask people, should you be able to get insurance if you have a pre-existing condition, they say yes. So why not let us vote yes or no on all of these independent provisions, some of which are very popular and supported, others of which may need some more work. And my position is that my constituents are entitled to know where I stand on each of these provisions. And the point of an up or down vote is that I'm on record, and then people can decide 2 years from now whether they want me to return or they want to send me packing.
So as
it's
of
about
when,
accountability.
I see, the latest information I have is just from about a day ago as far as how many members sign on, because that could happen at any time. It looks like it's only Democratic members. Any Republicans sign on with your proposal?
No, the Republicans are really united in this repeal. So it's repeal and erase everything. And, you know, that's a major decision that they made. This was a great campaign issue for them. And as I said, they beat us up. But we're not campaigning now. There's the responsibility of governing. And the question that any of us who have been elected has to ask is, what are the impacts of our legislation on people that we represent? And taking away these insurance reforms is unnecessary and very unwise.
Just a quick final question. I only have about 30 seconds here. But does it feel like there's a change beyond just this repeal of health care law? Does it feel like there's a change in the dynamic between the two parties, and that the two parties can work together on this issue and others?
Well, it remains to be seen. I'm hopeful, because I actually think a lot of folks everybody who got elected comes here with the same goals and aspirations. And this partisan line is getting in the way. We saw in the lame duck session a lot of progress being made on a bipartisan basis. And if America is going to start addressing its problems, we have to work together in order to do that.
Congressman Welch, a pleasure to have you as always, and we look forward to talking to you again, sir.